Hello, my name is Caleb Smith. I'll be your student nurse today. That was a little loud. Sorry about that. Can you tell me your name and date of birth, please?
Grant Mason, 06-13-95.
All right, Mr. Mason, great. So I'm going to perform a focused abdominal assessment. It'll take about 5 to 10 minutes. But if you have questions or concerns throughout the assessment, feel free to let me know. Are you comfortable with respect to privacy of the room and lighting in the room?
I am.
Okay. Patient is comfortable with the lighting in the room and respect to privacy of the room. Okay, Mr. Mason, here's a gown with ties in the back, and please empty your bladder before we begin. Now that that is out of the way, I'm going to start asking you just a few questions. Have you been experiencing any abdominal pain recently?
I have not.
Okay, if patient had been experiencing abdominal pain, I would perform the old CART's ICE questions and further assess what type of pain and characteristics of that pain. So have you been experiencing any nausea or vomiting recently?
I have not.
Okay. Have you noticed any abnormal characteristics of your stool? Like, have you noticed any blood or kind of odd things in your stool recently?
I have not.
Okay, when was your last bowel movement?
Last night.
Last night, okay. And can you describe that? Did it look normal? Any odd things about it?
Normal.
Okay. Normal and brown, solid. Okay, cool.
Yes, sir.
So what about urination? When was the last time you urinated?
This morning.
This morning, okay. And did you have any pain or I guess uncomfortability while urinating? Odd colors?
Yes, sir.
Okay, and none of that recently? No pain or like odors or anything while urinating?
Mm-hmm.
Okay, so patient reported normal bowel movements, normal urination patterns, and feelings. So now we move through that, we're going to start listening to some bowel sounds. Okay, Mr. Mason, if you lie flat on your back. And before I asked him to lay down, patient did appear normal, unlabored breathing. He looked comfortable, and so now we're going to assess his abdomen. All right, abdominal contour is flat. Skin turgor is elastic, no tinting. Skin color is appropriate for ethnicity. Umbilicus is centrally located. All right, so Mr. Mason, I'm going to listen to your 4 abdominal quadrants. Just breathe normally, and let me know if you have any questions, okay? All right, bowel sounds in all 4 quadrants are normal active. If there were an absence of bowel sounds, I would assess for a total of 4 minutes to detect if it's an actual absence of sound, and then I would notify the provider if that was the case. Okay, so now I'm going to listen to your abdominal aortic sound and also the sounds of your renal and iliac. Okay. Okay, now that I've listened to him with the belly of the stethoscope, I'm going to again listen with the bell to further determine sounds. Okay, pulses are normal, no bounding, no presence of bruise. Everything sounds normal. So now, Mr. Mason, we're going to kind of gently palpate each quadrant. Let me know if you feel any tenderness or pain, okay? Okay, patient reports no tenderness or pain in the 4 quadrants, and due to the nature of this course, we will not conduct deep palpation or percussion on this patient. And so that concludes this video on abdominal focus assessment.